Good evening, everyone. In the previous two videos, I have spoken in detail about the need of doing the semen analysis right at the beginning of your fertility journey and also about how, where, when to do your semen analysis. I have also shared a list of blood tests to be done along with the semen analysis. If you have missed any of these videos, please watch them without fail. As a continuation of this male fertility knowledge sharing series, today I'd like to explain how to read and understand your semen analysis report, the terminologies used in it, and what do they mean for your fertility. Namaskara, I'm Dr. Anupama Santosh, Bengaluru's top-rated fertility doctor with over 500 natural conception success stories. Semen sample is a gel-like fluid containing not just the sperm cells, which are the specialized cells for fertilization, but also seminal plasma with fructose, proteins, enzymes, alkaline substances, zinc, glandular secretions, and water. It is nutrient-rich and optimized for reproduction. The normal parameters of a semen analysis are based on the WHO 2021 guidelines. In your semen analysis, you may see these terminologies. Number one can be semen volume. What it means? It measures the amount of semen produced or ejaculated. The normal range is more than 1.4 ml. If there is low volume, let's say if it is less than 1.4 ml, it may indicate issues like low testosterone or blockage or retrograde ejaculation. In case it is more than 6 ml, could suggest infection or excessive glandular secretions or maybe some kind of inflammation as well. Number two is sperm concentration. What does this term mean? It's the number of sperm per ml of your normal sample. The normal range should be more than 16 million per ml. If it is a low concentration, we call it oligospermia, which is that it's lower than 16 million per ml. So it has fewer sperm than normal. And there is also a condition called azoospermia where no sperm is present, indicating a severe fertility issue. We call it azoospermia. Then there is a total sperm count. What it means is the total number of sperm in the entire sample you have given or the entire ejaculate. The normal range is considered to be more than 39 million in the complete volume you have given us the sample. Low total sperm count could reduce the chances of fertilization. The fourth is sperm motility. What it means is that the ability of the sperm to swim effectively forward. Think about this. The approximate distance to be traveled by a sperm to the egg is about 15 to 18 centimeter, which is actually a really long way for a microscopic cell like the sperm. So what's the normal range? The progressive motility, that is a sperm that swims forward rapidly, should be more than 30%. And the total motility, that is including progressive, non-progressive, should be at least 42%. So in case the motility is below this, we call it asthenozoospermia, and it indicates that sperm may be struggling to reach the egg. The fifth one is sperm morphology. What it means is that the percentage of the sperm with a normal shape. The normal range should be more than 4%. Less than 4% is called teratozoospermia. And highly abnormal sperm count, that is abnormal in shape, can reduce fertility drastically. And then they will also mention the pH of the sperm. What does it mean is that it is an assessment of the acidity or the alkalinity of the semen. Normal range is between 7.2 to 7.8. If there is a low pH, it may reduce sperm motility and viability. If there is a high pH, look out for any infection or inflammation in the body. Then there is a sperm vitality test. What it means that the percentage of live sperm in the sample. The normal range should be more than 54%. Low vitality basically means that sperm are non-viable or there is more percentage of dead sperms. Then there is a liquefaction time. What it means is, like I said, semen is a gel-like liquid. So the time for the semen to change from that gel-like to a liquid, which helps to release the sperm cells from the semen sample. The normal range is about 15 to 60 minutes is what you will usually see in your report, but around 30 minutes is what is desirable. A delayed liquefaction can impair sperm motility. That is, the sperm cells can find it hard to move if the viscosity is high. And look out for the white blood cell count in your semen analysis. What it means is the presence of an infection or inflammation in the semen. The normal range, that is the WBC count, should be lesser than 1 million per ml. In case it is higher than this, it may indicate possible infection in your semen or some kind of systemic infection as well. Last but not the least, if you have done a DFI, that is a DNA fragmentation index, that means that it indicates a percentage of your sperm with fragmented DNA. That is the percentage of DNA damage. If the DNA damage is lesser than 15%, it's excellent fertility potential. If it is between 15 to 25, we call it moderate fertility concerns, which may affect natural conception. And if it is higher than 25%, it is high fragmentation, the DNA damage is more, and it has reduced fertility potential and higher risk of failed fertilization, not only that, even miscarriage. These are some of the terminologies you will see in your semen report and what they mean, and some points to remember when you are interpreting this. Basically, this is an interpretation, should not be done isolatedly just looking at one semen analysis. In case you find an abnormal result, it doesn't always mean infertility. Other factors such as timing, general health, lab errors, there's so many other factors also which may affect the results. You may remember that I told you not to do a semen analysis if you have had any recent illnesses. Do it at least 4 weeks after you have completely recovered. And repeat testing may be necessary. Let's say if your report is highly abnormal, which shows azoospermia, which is zero count or really poor motility or morphology, do repeat the semen analysis to confirm it after probably 3 to 4 weeks. Like I mentioned in the previous video, always choose an andrology lab with a CASA facility, which is an advanced software to analyze a semen sample, and not a manual lab, which reduces the human errors. And consult your doctor. Always discuss your report with your fertility expert for an accurate interpretation. The fertility expert will interpret your semen analysis in various contexts like your lifestyle, BMI, your blood test reports, diet, your occupation, and give you a customized advice for your specific problems. Many male patients who come to me, I see their prescription, they've already been given antioxidants, CoQ10, multivitamins for most of the problems in their semen parameters. I don't say that they're not useful, but they have a very limited scope to make significant difference enough for conception. Do remember, Ayurveda has very effective solutions to all the problems reflecting in your semen analysis report. It could be volume, count, motility, morphology, and even the DFI. Actually, in 2024 itself, we've had 6 IVF failure cases because the male factor was not addressed at all, completely neglected. All the 6 couples have conceived naturally with Ayurveda medicine, diet, and Panchakarma to address the male factor. DM us to get customized solutions for your male fertility problems. Don't just dream of a baby, plan for a healthy baby with Ayurveda. Good night.